Okay, I'm Jaclyn Hawkins and I'm going to be doing a newborn assessment. This bear is as close as I had to a baby doll, so we're just gonna have to make do. So I am going to knock on the door, introduce myself. Hi, my name is Jaclyn Hawkins. I'm a nursing student and I was hoping to do a assessment on your baby today. Would that be okay?
Yes.
Yes, okay, wonderful. So I'm going to pick up the baby and unwrap them and just assess a bunch of things, but the baby, you'll be right here with us, okay? So I would wash my hands before I touch the baby. I want to make sure that the baby and the mom have the same bracelets. If I don't find that they have the same bracelets, I need to stop right there and let someone know. So I already know from doing my maternal assessment that this baby was born by vaginal birth and there were no complications. I would like a set of vital signs. I need a temperature. It's going to be an axillary temperature on this baby. I want to know what their pulse is. We can assess for the presence of a brachial pulse, but we're not counting that way. I will assess by listening to the apical beat later. And then also count the respirations for this baby. I would like their pulse rate to be between 120 and 160. Anything lower or higher is of concern for this baby. I would measure the length of this baby from head to toe. I'm going to be using a paper tape, which I don't have with me. Measure the length of this baby. We're going to measure the weight. The baby will go on a baby scale. They're usually measured in grams. And then we're going to assess the head circumference. So I would measure around the head at about the height of the eyebrows, and then the chest circumference at the level of the nipples. Head and chest should be about the same size. The head sometimes is a little bit bigger. So then I'm just gonna do like my general assessment of the baby from across the room. Does this baby look well? And I would say yes. Is their body in proper alignment? The baby, if I unswaddle them, is everything just properly in line? Does everything look symmetrical? Arms, legs, or does the baby have poor muscle tone? Are they a floppy baby? But this baby has nice muscle tone and they're holding their body well. This baby is not crying, but I would assess for a cry or a quiet baby. And then I can come down and assess their skin. So when I look at this baby, brand new babies that aren't super early or super late are going to be born with vernix. That is the white cheesy like substance on the skin that protects their skin. I would also assess for milia on the baby. I know a lot of people get milia on their face. They're the white pearl-like bumps that you can get under the skin and they do go away. This baby has lots of lanugo. So that's the baby hair on the skin that these babies eventually do lose. I would also look, it can be anywhere on the body, for the erythema toxicum, which is that baby acne like rash. It's a red kind of rash looking that can have some pustular acne like bumps that go with it. You can assess, I've seen them a lot on the back, the Mongolian spots. They kind of look like a bruise, but it is just a darkening of the skin, especially in babies that do come from other cultures that might have darker skin. And then I can also assess for petechiae, which are the little red bumps that can be born. It's teeny tiny ruptured blood vessels. So I come and assess the head of this baby. I want to assess the sutures on the fontanelle in this baby's head. The front fontanelle is going to be kind of in the center, towards kind of the center of the top of the head. It is a diamond shape and it is larger than the posterior fontanelle. The posterior can sometimes be felt, and as Miss Leek said in our video, it can be harder to feel in babies that were born with lots of hair. These fontanelles are more open, along with the sutures, allows for the baby's skull to move when they're being born. And then we want to make sure that there is no sinking or bulging of the fontanelle. We would assess for molding of the head. That's kind of where the baby's head reshapes itself during birth so that it can make its way out of the birth canal. Some babies have a little cone head for a little while, or if you're like my son, his head came out kind of sideways and he was molded sideways for a little while. They should take their normal round shape within a few hours or a few days. I would also assess for cephalohematoma, and that is the bruising to that baby's head. That can just be some trauma from birth. You can also see it with or without the caput which is just the edema of the scalp, which does go away over the next few days with these babies. So then I would assess the face for symmetry, make sure that everything is in line, eyes are in line with ears, eyes are in line with each other, the mouth is symmetrical, nose is symmetrical. This baby does not, it has a crooked nose, so the nose is not symmetrical in this baby. So then I would check the eyes. I want to make sure that the eyes are symmetrical. Most babies are born with like a gray or blue-gray eye color. I would assess the eyes for pearlescence. The pupils are equal, round, and reactive to light. We cannot really assess for accommodation in these babies because they have not seen much beyond an inch in front of their face, so they're unable to accommodate until their eyes, their vision continues to develop and they are a little bit older than they are. I would also assess for strabismus, so that would be a lazy eye in the baby. Currently, I do not see any strabismus in this baby. And then since this baby was born, especially vaginally, I want to make sure that there is no drainage from the eyes. I would look at the conjunctiva, make sure they're not developing a pink eye or an infection of the eye, which can be possible since they were born vaginally. I would assess the ears, make sure that the ears are symmetrical, make sure I don't see any malformations with the ears. If I do see malformation with the ear, I need to let the healthcare provider know. There's also a possibility that there could be a kidney development issue because Miss Leek said that the ears and the kidneys develop the same time in the womb. So if there was something significant enough to damage the kidney, it would show up in the ear as well, quite possibly. So I want to check the baby's nose, make sure that the nose, the nares are patent. Babies are obligate nose breathers, so they need to be able to breathe through their nose. That is how they breathe. They cannot breathe through their mouth yet because they breathe through their nose when they're feeding or, you know, sucking their thumb or a pacifier. That's what they do. I need to inspect the mouth. Is the mouth symmetrical? In this baby, the mouth is symmetrical. The lips, I don't see any sign of a cleft lip. I would take a gloved finger and insert it in the baby's mouth and assess the hard palate and make sure that there is no malformation to the palate or deformity. I would not need to let the healthcare provider know if I do find that. This is also a good time to assess the suck reflex. As I touch this hard palate, I should feel the baby suck on my finger. If I inspect the mouth, if I can see inside the baby's mouth, there's possibility I could see Epstein's pearls. They look like little white bumps in the gums. They're not teeth and they do go away. It's like a calcium deposit in the gums. I could also assess for swallow. It's going to be more observed in a baby that is currently feeding, and then I can assess that as well. Then I'm going to come down to the baby's neck. This baby doesn't really have a neck. A lot of babies don't really have a neck anyway. And inspect the clavicles, make sure that nothing is deformed or feels broken, make sure there wasn't an injury during birth, especially if this was a larger baby or a shoulder dystocia baby. Then I'm going to assess the chest of this baby. I'm going to face it so you can see what I'm doing. So we'd assess the chest. Sorry, this is in the way. I couldn't take it off. The appearance of the chest. Is it round? Is it symmetrical? I don't see that the baby is breathing abnormally. There's asymmetrical movement in the chest, anything like that. You do assess the nipples in the baby, the size of the nipple. Is there any engorgement from the overload of hormones from mom? They will have like a little breast bud. It is, I think like 2 to 3 millimeters. And then I would listen to breath sounds in this baby. Babies can have a bit of a wet breath sound when they're born. The pressure on their chest helps push some of the fluid out of the chest, the amniotic fluid that they are surrounded with in the womb. So I might hear some wet lung sounds, but if I was to come back later, that should be improving, not worsening. Before I stop listening, I would listen to the apical rate. This is I'm not going to do it in the video for time's sake, but I would listen to the apical rate. Same type of location as the adult. over in the left side of the 3rd to 4th intercostal space, and listen for a full minute for that apical rate. It is also possible that I hear a murmur, and that could be because the ductus arteriosus has not closed when that baby was born. Sometimes it closes immediately, sometimes it can be a few days or weeks for that to close, and you'll hear that murmur in those babies if it is audible. I would inspect the abdomen. This is a new baby, I have decided, so I should still be able to take a look at what where their umbilical cord was cut, and I should be able to see, it's almost like Mickey Mouse, 2 arteries and 1 vein, and that's how it should be. And then I would auscultate their belly. I should have just done that after I listened to the lungs and heart. And I should be able to hear bowel sounds. You would again listen for a full minute, and you should especially hear bowel sounds if this baby has already been fed. Then I can ask the parents if the baby has gone to the bathroom yet. Have we had a pee diaper? Have we had their first bowel movement diaper? Has the baby had meconium is like their first poop? And it's usually like a brownish greenish color, and we want to make sure, we would know it already when the baby was born if they had like meconium staining when they were born, or did it happen after they were born and that was their first bowel movement. So I'm going to come down and assess the genitals. For female, I want to make sure that the labia majora and minora completely cover everything. In a male baby, I want to make sure that everything is central. So the meatus is central. I want to make sure that if I palpate, I can feel the testicles, and that you can see the like wrinkles or the rugae of the scrotum. So then I also, when the baby's maybe not been here long enough, but we want to be aware, like, are they having pee diapers? Are they going to the bathroom? And make sure that they do have good voiding patterns, and we'll be able to figure that out the longer that the baby has been here. So in the first couple hours, we may not have established like a voiding pattern yet with this baby. So then I want to assess the extremities. I want to see that the, babies are wiggly even when they're brand new. Do they have equal and bilateral movement? Do they have good muscle tone? I don't want to see a floppy baby. If we have a baby that does not have good muscle tone, we have a problem. I want to check like range of motion in the arms and legs. With the hips, I'm going to face it towards me. I would rock their hips up and inward, and then rock that hip outward. I should not feel like any cracks or clicks, and if I do, that is a problem that needs to be mentioned. There could be some hip problems, especially if this baby was like really folded up in the womb. I would also want to assess, do they have all their fingers, they have all their toes, or all their extremities and fingers, everything is present. And then I can also assess their little feet. Sometimes babies come out folded up and their feet could look clubbed, but sometimes they're just folded up and it's not a club foot, and we want to make sure that they don't have any actual clubbing in their feet. I would, while holding the head, we're going to look at this baby's back. I want to make sure that the spinal column feels nice and straight and everything is in alignment. I want to make sure that there are no openings that I would see, which could be indicative of spina bifida. We would know if the baby had, if there was like prenatal care, we would know that this baby had spina bifida before they were born. And then we would also check the anus of the baby. If you run your finger over it, you should feel or see clenching, and that would be appropriate muscle movement and muscle tone for the anus. Then we would come and check this baby's reflexes. We already checked suck and swallow. The Moro reflex, if you're holding the baby, I'm sorry, that's not it. If you were to hold this baby and kind of drop them about 30 degrees, it should startle the baby and they should like throw their arms up. You can do the same thing by kind of pulling their arms, and they'll kind of startle and pull everything back together. If you would check the tonic neck, so obviously my little baby teddy bear is not going to do this, but if you rock their head this way, they'll stretch their arm out and pull this arm like this, and they'll do it the other way. And then if I was to grab their hand, put my finger in their hand, they will grasp. They will do the same thing if you put your finger at the ball of your feet. If you brush their cheek, that baby will root as if they're trying to find a nipple to feed. And then I need to move. So then if you hold a baby up and put their feet on the bed or on the table, you should see them kind of act like they're stepping. So they'll put one foot down and pick one up, and then they'll kind of flip and act like they're marching in place. And then you can also do a Babinski. So you come up and over, and they should flare their toes. And then so flaring toes in an adult is bad, flaring toes in a baby is good. And then I should have done this while they were on their back, but you can check the trunk. What you do is you run your finger down, and they should be kind of twisting their body towards that sensation, and they will curve to the side that is being stimulated. I would then assess this baby's behavioral or emotional state. Are they a quiet baby? Are they sleeping? Are they in a deep sleep? Are they crying? Are they alert and active? Are they as aware as a new baby will be of what is going on around them? And then after that, I'll thank the mom for allowing me to assess their baby. This baby will be re-swaddled and placed with mom or placed in their baby bed. Even though I already confirmed it, I would reconfirm the bracelet with the mom. With the baby, they should have matching bracelets so we don't switch babies. I'm going to wash my hands, again, ensure their privacy, make sure the bed is locked, lowered, call light is within reach, personal belongings are within reach, and then wash my hands, exit the room, and document my findings. Thank you.